We are talking again about the 5 steps to effective prescribing of behavior medications. I went through all of the different parts of step 1, which is decide to prescribe in previous posts. So take a look at those and become familiar with those. But today we're going to talk about step 2, which is choosing a dosing schedule. So you'll notice that I have not talked yet about make a diagnosis, etc., etc. First, we got to figure out if we're going to prescribe, then we got to figure out what the dosing schedule is. And there's a couple more steps before we even get to figuring out our medication. So here's the thing. In behavior medicine, it's really cool because you don't have a ton of choices. You can either do a PRN med, you can do a long-term med, or you can do both. Super simple. So you're going to do a PRN med when you have an acute problem, right? Sudden onset, it's urgent, the client needs help right now, the behavior is predictable, so you can pre-medicate for it. On the other hand, you're going to be thinking long-term medication. And again, you guys know if you're following me regularly that when I say medication, I really mean something that changes the chemistry of the brain. So that could be a supplement, a medication, diet, etc. Okay, technically, for all those behavior nerds out there, yes, behavior modification and environmental changes can change the neurochemistry of your brain, but we're talking about things that do it real directly in these posts about medication. All right, so if you have a patient who has a long-term need, who needs to be stabilized, or the need is not urgent, think about that foundational medication or supplement or a diet change, something that may take a longer time to work, but also will work for a longer time. And then you have that third possibility, right? The patient who comes in with the acute problem who also needs long-term stabilization. But for that patient, you're going to do both. You're going to do both the short term and the long term. So what is the take home here? The take home is that most anxiety disorders will require a PRN treatment. It's rare that you're going to have an anxiety, fear, stress, panic, frustration, conflict disorder where you just send the patient home with a long-term stabilization medication.